Well, welcome into To Your Health, and of course, over the past few weeks, we've been looking at foot health. Foot health is very important because obviously, one of the best things you can do in life is to be mobile. And if a person winds up in a wheelchair, well, they can still be mobile, but there's nothing like being able to just get up and walk, run, walk the beach, just enjoy life in general. So, today we have with us from Greenville Foot Care, which is in Greenville and Montgomery.
That's right.
Dr. Brian Kille and Dr. Lashonda Kille.
Hello.
And so glad to have you with us again.
Thank you for having
us.
us.
You guys have been doing a great job. We've been getting some great information here. Today we want to kind of address things that can happen in your foot. You go, I got a little bit of a tingle, or I've got a, it's my foot sweating excessively, or just different things that we need to address and not let linger, so to speak.
Yeah. Going back to the tingling, that's something you hear a lot of now. There's a lot of commercials for medication for neuropathy, and I thought it'd be good to kind of address what neuropathy really is.
Right.
Because just because you have burning in your foot doesn't mean that you have neuropathy as they're trying to portray on TV. There are several forms of neuropathy that can present with those symptoms. And it's important to figure out which one is causing the trouble, because the medication isn't always going to be the treatment. There are other forms that can be done, and some are treatable and some are manageable. So like I can cure certain things, like neuromas, which is a damaged nerve or an inflamed nerve that presents in the ball of the foot.
Okay.
So you're walking and you start to feel like your sock is bunched in your shoe, or you've got a small rock in your shoe, and you're checking, but nothing's ever there. Yeah. Okay. And then your toes will start to tingle and burn, and you might even get some shooting pains.
Might even have some numbness in between the toes.
Right, numbness in between the toes. And so that'll be quick to be called neuropathy, which it is, pathology of a nerve, but it's a treatable form. And we see that very common. I probably deal with 30 patients a week that have neuromas. And you deal with them through biomechanics, inserts like we had talked about on previous segments, injection therapy, and possibly surgery in some instances, and it goes away. And it's done, it's gone, rather than taking a medicine to try to cover it up for a long time.
Well, it's important to mention that medication used to treat neuropathy, like if you have diabetic neuropathy, does not help with a neuroma. So you could be taking medicine for this problem. What he was talking about, the inflammation in between the bones. Right. So when you step down, you may feel some tingling, some shooting pain. The medicine that's used to treat neuropathy doesn't necessarily treat the neuroma. So rather than taking medicine for a problem that you have that's not going to work, it's important to distinguish whether or not you have true neuropathy or if it's a neuroma. There's other things it can be as well.
Right. Probably the next most common is called Tarsal Tunnel syndrome. And everybody's heard of carpal tunnel syndrome, right? You do this and your fingers tingle.
Right.
Well, tarsal tunnel syndrome,
from, like they say, that's from being on the computer.
Right. Sitting here like this for a long time.
But your toes are doing the same thing, but they're not on a computer.
Well,
that's true.
If your arches are falling,
then
your
toes are
actually
working harder.
Well, that, and you're stretching the ligament across what's called the tarsal tunnel, which is on the inside of the foot.
All right.
So here's the big toe over here. This is the inside. The nerve.
So that's your hip way over there, right?
Yeah,
right.
Yeah, that's the hip.
Trying to get that out.
Well, that's okay, because they talk about the hip bones connected, everything's connected.
So the tarsal tunnel is your major nerve and artery that come down along the inside of your ankle and control everything on the bottom of your foot. And when you flatten, it's like doing this on a computer. It's stretching and crushing the nerve, which will lead to tingling and burning on the bottom of your foot. So you're standing in line at the grocery store. Your foot starts to feel like it's on fire, but then you move and it goes away. That's tarsal tunnel syndrome.
Okay.
And so it's a form of neuropathy, but it's a treatable form of neuropathy. Again, we can go back to those inserts we talked about, and injections and surgeries and things like that, and I can fix it.
So, basically, obviously, like anything else, the earlier you can detect and treat it, the better off you are.
Absolutely.
Number one.
Absolutely.
I think that's a key. Obviously from patients that you see, most of them can be treated without having to do surgery for the most part. But at the same time, if it's necessary, it's necessary.
Right. Well, it goes back to your longevity.
Yes.
If you wait around and have the symptoms for 2 years before you come in, surgery is going to be a higher probability.
Right.
If you catch it early,
Mm-hmm.
treat it early, yes, it's most of these nerve pains in the foot will go away conservatively, probably 85 to 90% of the time.
Mm-hmm.
You know, but the longer you go, the higher the chance of the surgery. Yeah.
Mm-hmm.
I do want to say though, sometimes tingling in the foot is neuropathy.
Okay.
And nerve damage from diabetes or damage to your back can cause problems with your position sense. So basically that means when you walk, knowing where your foot is on the ground without actually looking at your foot to see where it is. So when your position sense is affected and you have neuropathy, that can cause things like falls.
Mm-hmm.
So that's one of the big things that concerns our...
Especially as you're aging.
Exactly.
Talk about
Right.
aging people and falling.
Exactly.
Yeah.
So it is important to treat things like neuropathy.
Mhm.
Sometimes that means a little bit of therapy to sort of retrain yourself how to walk without having a good position sense, and using aids like canes or walkers if necessary, because if you can't feel where you're placing your feet, then you are more likely to fall, and that can also cause issues with driving. Not knowing whether or not your foot is on the
Ooh,
brake or the
gas
gas.
or the-
Mhm.
Exactly. So
Yeah, that would be a dangerous one.
absolutely.
Yeah. So so what we're finding out is that obviously the key to anything is early detection.
Right.
Yep.
And at a certain, now, is there a certain age where you should be having a yearly podiatry exam? Is that, did I use the term right? Podiatry
You did.
exam?
You did.
Right.
Yeah.
Yeah.
If you're diabetic, regardless of the age,
Yeah, I am a diabetic.
yes,
So besides my doctor, I should be coming to see you.
you should be
guys.
coming to see
Yeah.
us every year.
Yeah.
And we will keep a track on any pathology or problems that we find,
Mhm.
and get started on treatment and
Yeah.
therapy for that. We will also do circulation testing to at least to
Mhm.
establish a baseline to make sure there are no blocked arteries in your lower
Right.
extremities, just to keep you on track and make sure that there are no issues. And that
Mhm.
way we'll have a record of, you know, well, here you were fine and your circulation was fine, but maybe 2 years from now, okay, now we can see that there, between your knee and your ankle,
Mhm.
there was something going on. So,
Right. Well, this has been very enlightening, to say the least. And just remember this, there's no appointments that are, there's no referral that's necessary. Appointment is
Appointments are
highly
necessary.
recommended.
Yes,
You
yes.
do need to have any, don't just walk in and say, look at my foot.
Right, right, right.
I'll tell you a story about that later. But there's no referrals that's necessary. Obviously, as you're getting older, you want to make sure that you're having a great life. If you're diabetic, again, as they mentioned, be sure that you're getting in there at least on a yearly basis. And most insurances are going to cover it because of the diabetes. And we'll be right back right after this.